Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in another video where I'm using the WAXscope. And in this video I've got two cases for you, and in both cases, in both patients, I'm using both microsuction and also the Curette to remove the earwax. So this is patient one and this is their left ear. You may have noticed that the entrance of the ear canal is very narrow. And this is where the WAXscope is quite beneficial because you can use the speculum that's attached to the end of the WAXscope to dilate open the entrance of the ear canal. And the lateral surface of the wax where I've got the suction tip against, it's very dry and it's quite a rough and bumpy surface. So the key here is when you are performing microsuction, you want to make sure you get a good suction grip. And the key to that is not to come away too quickly with the suction tip itself. Once you've got it on there, you want to kind of keep it on and slowly wriggle it out. And the reason for that is if you lose that airtight seal, then inevitably you're going to use suction power. And it's difficult to do, it's not always possible. So I'm just going a bit higher on this wax plug where I think it's a bit softer to see if I can get that suction grip. And I have leveraged it forwards, but at this stage, this plug it's trapped. The ear canal is quite narrow. The plug is larger than the entrance of the ear, so it's quite difficult to maneuver out. So I'm just going to go back in again. Again, I'm just looking for a different spot. That the original part of the wax where I was suctioning, it was just too rough, and I just wasn't getting the suction grip. So I'm just going a bit higher up. But I think now this is where I'm just going to use the Curette. So I'm just dilating the ear open a bit more. There's a bit of an opening there. And I'm just reaching into that opening, use the Curette and slowly bringing it forwards and out of the ear. I did take a still image, but I've got so many still images of wax on my phone, it was difficult to know which one was which. So, but it was quite a substantial piece. So there's the patient's eardrum. In retrospect, could have possibly used a smaller speculum. I'm using the medium-sized one here, and I probably would have gotten a bit deeper, but I can still see the whole eardrum, so that's completely fine. And I think this is the same patient, but just their opposite ear. This wax is a bit softer. So I'm just going to the bottom of the ear, and I'm going to separate this wax. It's quite a sticky consistency, and it's adhered itself to the canal wall, and there's a few matted hairs there. So I'm just lifting it away off the canal wall, trying to separate it. And once you've separated the wax plug, you can then try and maneuver it out. And again, just being a bit critical of myself, I probably could have just reduced the exposure slightly because it is a bit reflective there, but it wasn't impacting my ability to remove the wax, so I just continued. Once again, the entrance is quite narrow, so just going to maneuver this out. So on the right, you've got the first bend. Sorry, that's the tragus. On the left, you've got the first bend. And I'm just rocking this wax up and down, left and right, trying to bring it through and out of the ear. And I'm not sure if I used the Curette again. Let's see. Yep, there we are. So I'm just going to go up and over the wax and slowly bring it forwards. In fact, I think this is patient 2 because it's their left ear, unless patient 1 has got 2 left ears. So yeah, this is patient 2 again, it's just in their left side. I think I'm going to bring the exposure down a little bit here just to get, there we are, just to get a bit of a clearer view of the eardrum. You can see they've got quite a prominent anterior canal wall, so it's very difficult to visualise the anterior recess. With an endoscope, it would be possible to view that part of the ear, but when you're using a speculum to examine the ear, there is going to be limitations. The outer third, the cartilaginous portion, we can manipulate that to some extent. We can dilate it and somewhat straighten it, but you can't straighten the bony part, the inner 2/3. So you're somewhat limited by the patient's ear anatomy in terms of visualization. And that's where, again, I think the endoscope, if someone is comfortable using it, it does open up a lot more opportunities in terms of earwax removal. But with the WAXscope and microscope and head loops, you are constricted by the patient's ear anatomy to some degree. So again, this is patient 2. This is their right ear. Sticky earwax again. So again, I'm doing this in stages. I want to separate this off the canal wall. When I first started doing wax removal, my aim was to kind of just bring it out of the ear straight away, but then you realise there's processes you have to go through, and first of all we just want to separate it, which I have, and now I'm going to just try to wriggle it through and out of the ear. Because it's a bit softer, we're able to do that. So I can't remember the patient, but I'm assuming probably more of an elderly patient, just by the length of the hairs that they've got in the ear, the high keratin content. As patients get older, the skin gets drier. There's less sebum secretion, less oily sweat secreted by the modified ceremunous glands, which are modified apocrine glands. So this modified sweat, it's kind of an emotional sweat, and sebum, which is an oily lipid secretion, they're designed to help to lubricate the ear, kind of provide some acidity in the ear, because a lot of the pathogenic bacteria, they are neutrophilic, so they want neutral pH conditions. So both sebum and the emotional sweat help to provide what we call an acid mantle. And also, I think I can tell the patient's probably a bit elderly because the entrance of the ear canals collapse somewhat. The cartilage is weakened over the years, so gravity takes its toll. Well, I hope you enjoyed that video, guys. If you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.